My name is Matthew Lewis of Lewis Plastic Surgery. I'm here today to introduce my friend Eric Majors. He reached out to me about a month ago with concerns for receding hairline and wanted to talk about what was possible to restore the hairline and really to create a nice, sharp frontal hairline. So anyway, he's here for his procedure today, and I was going to turn the floor over to Eric so he could talk about what he's looking to achieve, and we'll go from there.
I've always just had a very sharp haircut, and it's something that means a lot to me. I mean, you see it in kind of popular culture, and it just also from a standpoint of even culture, the barbershop, like that is somewhere where, you know, that's where you talk sports, you do all these other different things, but it's a cornerstone to, you know, not just, society, but also specifically in the Black community. So I really wanted to have the opportunity to try to restore that hairline. When I realized I started started noticing the hair loss, one of the things I continued to do was find ways to, maybe change my haircut or even change the way that, the fade is during the haircut, so that I could, create that illusion that, I'm still in, the barbershop and getting the normal haircut and it's nice and sharp. But over time, I just noticed that it continued to go further and further back and started to recede. So I really started to look at, what the alternatives were to really allow me to continue to get that sharp edge up, because it is a really big part of, the look, and then also the barbershop experience is something that, you go to, on a weekly or bi-weekly basis just to, engage with, people in your community. And so for me, it was more than just the look, it was also just the community that you gain through, the barbershop experience.
For hair transplants, the way we start is with a formal consultation where I evaluate the patient, see what they're looking for, make sure that what they're trying to achieve is achievable, supposing that it is, and typically most patients are good candidates. As long as they're not too young. There are some patients, who are in their 20s who are going to have additional hair loss further back, and sometimes filling in the front in those cases can mean that the hair will then recede back from that and leave kind of like a wall of hair. So with those patients, we have a little bit more conversation, like should we blend further back and not put as many up front? Should we hold off? Or are we just thinking that there's a good chance you may have a second procedure in the future? But we talk about all those things, so the patient's really well educated on the procedure, and then I usually make a recommendation for how many grafts I think it's going to take to achieve that. So typically, a standard hair transplant case for a male with receding hair is around 2,000 to 2,500 grafts. We can go up to 3,000 grafts in a single go. Sometimes someone just needs just their temporal triangles filled in. Maybe it's 1,000 grafts. So there is a variability, but on average, about 2,000 to 2,500 grafts. Once they've met me, we've discussed, they're excited, they want to go forward, we schedule a procedure. And the next time we meet typically is for the operation. Operation is done in our office, so it's in an exam room, so it's not, it doesn't have the anxiety that comes with it of being actually in an operating room. I typically do it under something called Pronox, which is laughing gas, which is patient administered, which is great. That way, patients can use as much or as little as they want. Most of the procedure is very comfortable. Really the only areas where there can be discomfort is the initial numbing of the scalp, which is injections of lidocaine into the scalp to get it numb. And I usually have patients breathe some Pronox at that time. So with that, they take multiple breaths, and things start to seem like they're funny instead of painful. That's the best way I can describe it. It just really kind of dissociates patients from the discomfort. So they take some puffs, as many or as few as they want. What's good is you can't overdose on it because the patient themselves actually has to initiate the breaths. They take some puffs. I inject the whole back of the scalp. This typically the back of the head is where we take our grafts from. And we get it numb, and then we start the procedure. So the way the procedure starts is by taking the grafts out one by one. So this is kind of where we talk about different types of hair transplant procedures. The very oldest was something called hair plugs, where basically you would take little punches, like 4 millimeters in diameter, little circles of hair from the back, make little punches in the front and stick them in. That worked, and then it brought hair forward, but it did tend to look like doll hair, and was kind of that typical hair plugs that people made fun of. So kind of the next iteration was something called the strip method, where actually a strip of the back of the scalp was removed in block, and then the back of the head was sewn up. And that strip of skin with hair in it was then carefully partitioned with a razor blade into all the individual little hairs. And then hairs were transplanted individually, one by one, into the front or the crown or wherever you were augmenting. That procedure was much better because by moving individual hair follicles, it looked much more natural. And there are still some instances in which that is still a procedure you might want to pursue, specifically if you need more than 3,000 grafts in one go. But for most patients, they don't need as many, and avoiding that scar from ear to ear is super helpful. So what follicular unit transfer, or the neograft procedure is literally doing the punch graft like we talked about with the hair plugs, but doing them as individual follicles. That's what FUE is, follicular unit extraction. We're taking out the little follicular units and then moving them to the front. So the cosmetic result is similar to that of a strip method, because what we're doing up front is the same, but we're doing it without that ear-to-ear scar. The question comes up is, well, there's FUE and then there's neograft. Why is neograft different, or are they the same thing? What neograft is the machine that allows us to do FUE gently. That's really all it is. And so it's a little punch with a very gentle suction on it. So instead of punching out the graft and squeezing it with a tweezer where we could crush it, damage the follicle, we punch, and that light suction just pulls the graft and it puts it in a little moist chamber that keeps it moist and healthy for transplantation. So neograft is simply a way of doing FUE gently, and it's gentle enough that I quote patients about a 97% take rate, so about 97 out of 100 follicles that are transferred survive and grow. So on the day of the procedure, once the head's numbed, we start punching out the grafts, and basically the patient is in a prone pillow, which basically looks like a massage chair pillow, face down, and we poke out the little grafts. So each follicle is taken out individually. So it is a long process. It's a little bit long and tedious in that we're literally punching out 2,500 grafts. It's also important to know that hair follicles aren't single hairs always. Is hair grows as either 1, 2, 3, or 4 hairs in a group. And so the follicular units have 1, 2, 3, or 4 hairs in them. And we actually divide those up during the procedure. So as we were getting the grafts, we're actually splitting into we put all the 1s over here, the 2s over here. The reason is we can use the 1s up front to really make a very natural hairline, and we can use the ones with higher density further back just to fill in and look thicker. That's a way to do a really natural look. So when we talk about doing 2,500 grafts, we're really talking about somewhere in the neighborhood of about 6,000 hairs when you're transferring 2,500 grafts. So that's an important thing for patients to understand. But we take all those grafts out, and once we've harvested all the grafts, we put a compression dressing on the back of the scalp. Basically, you just have a bunch of pokes in the back of your head, and so we put it so it's a little bit oozy. Put an absorbent pad and a wrap around the forehead, which just keeps it dry and clean. We then sit the patient up, and then a little more Pronox, and start to numb up the area that we're going to transplant into. And at that point, we will also go over the hairline again. So I've gone to school and know how to draw an ideal hairline based on facial thirds, based on what's called the villus hairs, or the hairs that really don't fall out. And I can give patients a pretty good idea of where their hairline should be, but sometimes patients want a little tweak. They maybe want it a little bit more forward than, maybe a little bit more youthful than would be natural, and we'll have a discussion about that, and we'll design a hairline together that makes sense. So we draw that out, numb it up, and then we just basically take a little tiny needle, make a bunch of pokes, 2,500 pokes if we're doing 2,500 grafts. Once all those little holes are made, we let the patient take a break. We order you any food you want, so patients can say, hey, I want some tacos or something like that. We like patients to take a break and have some lunch and just chill out a little bit. While they're eating their lunch, we're sorting the grafts, getting them all ready to put back in. Once lunch is done, we kind of go for the final push, which is to put all those little grafts into all those little holes we made. And that's again another long, tedious task. Because we're taking grafts out, putting them in one by one with tweezers, the whole procedure, if you're doing 2,500 grafts, is 6 to 7 hours. You're here with us. But we play music. Patients can bring Kindles, ear pods. We like to think that we're funny and entertaining and that we're fun to talk to for that whole time. But we try to make it a fun day for you. And once all those grafts are placed, we just put you in kind of a little wrap and a little hat that stays up off of your scalp, just to kind of protect and just so that you don't scare people when you walk out of the hospital, or the clinic, I should say. And that's it. That's the procedure. After the procedure, by day 2, that wrap can come off the back of your head. It's amazing how quickly, since they're little pokes, how quickly they scab over. And it's really hard to tell that anything ever happened to the back of the head. By day 2, it just looks like a bunch of little pimples on the back of your head. Usually by a week out, the hair's grown out enough and the scabs have fallen off that you really can't actually see that anything happened to the back of the head at all, which is amazing. By 1 week, the grafts have been placed, have formed a lot of scabs. We do try to keep the scalp moist and do things to get the scabs off as quickly as possible. But they do last for about a week to 10 days. By a week to 10 days, the scabs have fallen off and now patients just look like they have stubble in the area that was transplanted. And then at that point, a lot of the hairs fall out. So there's something called shock loss, which is where the follicles that have been transplanted, they're alive and viable, but they shed that hair. So a lot of the hairs fall out, which is always a little bit of a downer part of the procedure, because somewhere around the 3-week mark, patients look like nothing happened to them whatsoever. Their back of their head's healed up, and the area that have been transplanted, a lot of the hairs have fallen out. And so they look literally like the day before the procedure. And then that starts the process of the hair growing back in. And then over the next several months, the hair starts to grow in and you get this full head of hair. So important things to know about the procedure, obviously, is that it's not, you don't wake up at the end of the day with long hair. It does have to grow in. It is a process, but it works really, really well. Once the hairs have grown in, they're your hairs. They are stuck in your scalp, and you can do any haircuts you want, use any products. It's as though it is truly your normal hair. And that's kind of the start to finish of the whole thing.